This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. If you don't know why that matters, listen to episode 106, where we talk about board certification.
We broke it down.
Dr. Martin, how are you doing?
I'm doing pretty good.
Good. Well, we have a fun topic today, and if you're interested in seeing the slides that go along with this podcast or the video, you can find that on our YouTube channel at Jason Martin MD. Not super interesting with slides, but there are some cool ones, and we talk about some cool stuff. So
it's a salacious title, though.
It's worth watching.
Yeah.
So I love this. So, Dr. Martin, do you think your fat can predict your age?
I don't know, but it's very intriguing when the way you wrote that out.
Can your fat predict your age?
I actually think so.
Yeah, I mean, we've talked a lot about fat. If you want to listen to us kind of geek out about the functions of fat in the body, our podcast where we let's talk about fat.
It's literally called Let's Talk About Fat.
Yep, and we talk about fat.
And we made some jokes about TLC.
We did. That podcast more than any other, I think we did. We dropped a lot of song references.
TLC references.
Like at least 3.
Yeah.
But I think this is, I think fat is fascinating. And the way fat functions in the body is really more of an organ than just a cell. So can fat predict your age? I think it's a great question. So this is also called AKA Let's Talk About Facial Fat.
Right. And I know where we're going with this, but just on an anatomic level, I think fat could probably be able to predict your age too.
Yeah, and fat's pretty predictable also.
Right.
And that's why. So let's jump right into it. Facial aging is a multifactorial process, and we have talked about this a lot.
Yeah, why do, everyone listening, why do we age? It's so frustrating. All of us in this room right now are like our 40s, and it's like, it's interesting.
Right.
Why do we age?
Well, that's just
our face. So let's start with our face.
Facial aging.
Yeah.
Facial aging happens for a lot of reasons. There's basically 2 categories of aging: is intrinsic and extrinsic changes. So the intrinsic things are like your genetics, extrinsic things are environmental. And that's the same with every system in our body, really. I mean, part of aging, as far as we know it now, we talk a lot about this on our longevity podcast, our cells are somewhat programmed for death at a certain point. Telomeres shorten, your breaths run out.
Oh, here we go.
Your bone marrow goes away, your stem cells die, and you die. And
by the way, this is what Amy, this mantra every time she gets up. She goes, I hope I have enough breaths today.
I hope I have enough telomeres. Hope my telomeres are still there. So
I mean, I've never seen someone so morbid.
But there are other things too, right? Our external factors, environmental things. I mean, people who have accidents and other things happen to them, obviously their life is cut short.
The biggest cause of death, at least historically, has been trauma.
Mm-hmm. Yep. So those are things you can't really control per se. In some cases you can. And with the face specifically, the genetic things are your skin, the fat, the muscle, and the skeleton.
There's actually something I read. It was like scalp, skin, subcutaneous tissue, the layer that I will not say because you can never pronounce its name, submuscular fat, and periosteum, which is bone.
Yep.
So the scalp. But it is. I mean, it's the skin. It's the fat underneath the skin. It's that muscle layer, that foundation we talk about all the time. And if you go back and listen to our recent facelift episode, which is really good, we talk about that foundation layer, the fat under the foundation, and then your bone itself. And it's multifactorial. That's the medical word. There's so many different things going on at the same time. Recently, I was reading, because it had nothing to do with this episode, even though I should act like it was, but it had to do with this test I was taking for aesthetics, and it asked this question about facial fat, and I didn't agree with the answer. So I went back and started reading stuff, and it was just so divisive, these articles about the anatomy of the face. Mm-hmm. And it's like these plastic surgeons and these anatomy PhDs arguing about what happens when you age. And so they were getting all up into the weeds about what's going on in the face, but it was just so interesting.
And it is. I mean,
But they were not on the same page. Just so you know. Like there was a lot of argument about, is this what's going on or that's what's going on?
And everybody, I mean, that's just it. Everybody's coming at it from a different angle. I mean, I think a good example of that is years ago when you had a cosmetic dentist talk to you about thinning bone and that changing the appearance of a person's face, like more than anything else.
I actually think that loss of bone in the face is one of the biggest contributors to aging there is. And people don't understand that. But osteoporosis and lack of bone strength, which, by the way, Amy, what you know better than most people, what increases bone strength?
Like mechanical assault, essentially. So like the pressure that you put on it.
Which is why when you lift weights, it's really good for your extremities and body.
Standing. That's why people who...
And then also nutrition, right? Vitamin D, all the stuff you talk about. Yep. And so, if you're not actively in your body at least, but, putting pressure on these areas and also you don't have good nutrition, the process of aging is going to take away strength from your bone. You take away strength, it's going to take away volume. Loss of volume equals lack of foundation for the structure of your face, the anatomy of your face.
Yeah, bones have blood supply just like everything else, which is why like infection that gets into bone is so dangerous because it's got blood supply.
Dental caries. What's the layperson term for
cavities?
Cavities. Dental cavities. Those are really bad. Every time that dentist goes in and starts, cleaning out your
Bacteria.
teeth, it's not good because the teeth actually strengthen that bone. There's a really symbiotic relationship between teeth, the blood supply to the teeth, and the bone itself.
Yep, the jawbone. And I can say this from personal experience. I had my wisdom teeth removed just a couple of years ago, and it absolutely, I felt like, changed the way I talked. It changed the way I chewed. It changed everything.
Yeah.
Like it made my mouth, it just literally changed so much.
I was so upset when you did it. You really changed. I missed the old you at pre-wisdom teeth.
Pre-wisdom teeth? Well, I still have two on this side.
Did it really change that much?
It did. It changed a lot. Yeah. And I actually went and saw a dentist for it after the fact because it did change so much.
What did the dentist say? Like, it changed some stuff?
It did. And I actually had to wear like a little splint for a while. I mean, it absolutely does change things.
Yeah.
And like bone fills back in. And a lot of why I noticed it was because I had my wisdom teeth removed at a more advanced age.
Right.
As an emergency procedure. So most people don't have their wisdom teeth into their late 30s, but I just happen to. And I still have two of them.
Right.
But I don't have, but you notice that difference, and that has to do with the bone.
If you get in your 30s and 40s, you'll start to see that your incisors, the front teeth, the ones you see when you smile, start to rotate and crowd. And that's all related to the way that your not only your occlusion changes with age, but also the loss of bone. And so that's why you see a lot of people have Invisalign. I have Invisalign right now, but or have braces as they get older, is to expand out that occlusion again, to get it back to its more youthful kind of orientation. But the problem with that expansion process is that can make bone loss worse too if it's done incorrectly. So, bone loss is a really big factor in aging, and people don't understand that. It's never talked about either.
Well, because it really is the bottom. I mean,
it's the foundation. It's the foundation of your house.
Built on.
What else contributes? Real quick, I know you want to go on to the next slide, but what else? Skin, right? We all know skin. Why does skin contribute? Because that's the covering. And you can see wrinkles, you can see sunspots, you can see changes in the way the skin looks, and the skin thins. We've talked about this a million trillion times.
Well, and that's probably the thing that's the most impacted by the extrinsic things.
100%.
Is skin.
Sun exposure, smoking, health, changes in your weight for sure. That denudes the skin, thins it out.
Stretches it.
Yep. I think, personally, if you want to ask me one thing that truly defines aging of the face, is the changes in fat.
Yep.
And I'm not saying that because Amy chose this topic. We did not talk about it, okay? So I actually think the fat changes, both loss of fat and descent of fat, I'm sure Amy's getting to this, are really where aging comes from. Now, the muscle layer, the foundation layer we talked about the whole time, when you do a facelift, you got to lift that foundation layer, which is the muscle layer. But that muscle layer is connected to the external fat, which is like cheek fat and things that we see.
Superficial fat.
Superficial fat, sorry. And then the deep fat.
There is no external fat, hopefully.
There is when we suck it out with liposuction.
Then it's external, but we throw that out.
So that foundation is connected to that fat. So when you lift that foundation, you're actually lifting the fat itself.
Yeah, and I agree. I mean, we did talk about that in our perfect facelift episode. The skin is like the least important part of aging. It really is. Like you see it the most, but it's kind of the least meaningful in terms of youthful appearance.
Right, which is so weird. Think about this. Everyone listening to this. You go into the dermatologist and they're like, oh, what you really need is a laser to fix your skin. And that's why you look old. In reality, that's the least important thing. Now, you should definitely fix your skin and get the treatments, and it works, IPLs and ablative lasers. But in reality, it's that loss of fat, descent of fat. It's a loosening of that foundation, loss of bone, all the things associated with that to really contribute to your aged appearance. And that skin is the least important. But what does everyone fix? The skin. What does everyone focus on? Their skin. They come in all the time. They're like, oh, look at my skin. Look how terrible my skin is. Look at all these wrinkles. Like, the reason you have wrinkles is not really the skin. It's the stuff underneath. You've lost a support system there. The bone's gone down. Your muscles are very active in those areas, and it causes wrinkles. It's this kind of milieu of stuff going on, and no one ever treats the real problem.
And that's true on the entire body, not just the face. I mean, we're talking specifically about the face, but that's true of the rest of your body as well. Like, when you start to have saggy skin, especially like on your arms and legs, I mean, into your 60s and beyond, a lot of that is because you lack that underlying structure. Your bones start to thin, your muscle is wasting, you have sarcopenia, like all those things are contributing to the skin looking worse, but it's really coming from losing that foundation.
So one of the best answers for loose skin on the arms is actually muscle tone and muscle volume. Yep. That's what fills out that envelope and really takes up the loose skin. Sometimes cases you can't do that. I mean, if you've had massive weight loss and you have a lot of extra skin there, it's unavoidable. But
or if you just have genetically looser skin, that we talked about that genetic skin. Your skin condition is somewhat genetic based. But let's get back to talking about the volume in the face specifically, and really go over why it doesn't happen all at the same time. So I have a little picture here in the bottom. It might be kind of hard to see, but it shows the difference between the superficial and the deeper fat pads. And these you see very much so when you do dissection in a cadaver lab. You can really see these. And additionally, and something that I didn't talk about on any of these slides, but that you lose as you age too, there's these tiny little ligaments that are attaching, the fascia to the skin, to the muscle, to the bone, like that are attached through all these fat pads as well. So when that fat starts to go away, it's kind of pulling down on everything else around it too. So
those ligaments, like the malar reticular ligaments, I think that's what they're called. You got mandibular ligaments, and those things define these anatomical areas. And when you start to lose fat, those ligaments tether in, and that's where you see those creases going across the cheek, even tear troughs.
Yeah, especially tear troughs.
Yeah, you have association with that. Marionette lines, look all that stuff up. They become more prominent because those ligaments really don't go away. They sometimes harden actually with age. It's the same thing with cellulite. Cellulites are these tangential, like perpendicular ligaments that go from the muscle fascial layer to the skin. As you age and with swelling and chronic swelling and just overall changes with life, those things get brittle and hard. The same thing can happen in the face. Really tethers it in. So you have these really invaginated tethering areas, and then you have sagging, loss of fat in other areas. And that in totality gives you that aged appearance. The superficial, if you're not looking on YouTube, the superficial fat would be your cheek fat, right? What are the superficial fat pads?
So they're the lighter colored ones here.
Okay.
So there's both. There's superficial and deep throughout the cheeks.
Yeah.
Really the areas, and I have a better slide that kind of shows how they progress with age. The superficial, though, are kind of the central, the middle temporal, lateral cheek, which there's also deep there, supraorbital and infraorbital, which is around the eye. And those are, the ones that you really see go first. The deeper ones are going to be kind of the same areas. So there's also lateral temporal cheek. Those are deep as well. So if you look at the picture, you kind of see the lighter colored ones are on top of these darker ones. So they're in very similar areas, with the exception of some of the ones around the eye. Some of those are only superficial.
So when you notice the superficial ones lost first, and that's what you usually do for filler injections. That's when you start injecting.
We're going to get there.
Okay. The deep ones are less noticeable, but those are the ones that if you lift the foundation or you do facelifts, that can make a big difference too. So just so you know, these deeper fat pads are very important.
Yeah, and we've basically talked about everything that I have on this slide, just that facial fat atrophy is predictable and directly influences volume and shape of the aging face. So they've studied many, many faces, many, many cadavers, and you really can pinpoint by decade of life where you start to see these losses happen predictably. And we'll show that on the next slide in a little bit better picture. We talked a lot about the changes in volume distribution. There's two things, though. You have what you talk, the descent of fat, but then also just the loss of fat in general.
Yeah, so it goes
both
down.
Happen.
Yeah.
It
goes down and you lose it.
Yep.
And you gain it in other places you don't want it. That's what we always say.
It deposits other places. Yeah. But I agree that, like you said, fat atrophy may cause greater significance than soft tissue laxity and bone changes. So even though the bone is the base foundation, when the fat kind of starts to go, everything is going to let go around it too. And these changes are visible. I put in the early as the 40s, but I think in some cases, just genetically, you can start to see these changes sometimes sooner than that as well.
For sure.
Yep. So let's take a quick break, and then we're going into the other slides.
What's our break for, Amy?
Our break is to talk about Let's Get Checked.
Let's get checked.
Let's get checked. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, we're back. Everybody get checked. Okay, so this was the slide that I didn't want you to jump all over because it's a really cool one. So this shows it a little bit better because it's a little bit more contrast. That shows where you kind of start to see the first followed by the last changes. So if you look on the slide, the lighter green to the darker blue is kind of showing where you start to see these changes in facial aging first for volume. So the light green around the eyes, remember I said that is the one area where there is really no deep fat there. It's all
so if you're not watching
superficial.
on the YouTube channel, the loss of fat or the changes in fat is most notable around the eyes first, and then it moves to the forehead and temporal area. That's the area on the outside of your eye. You get a depression there, and then you move down to the perioral area around your mouth, so the nasolabial folds and the jowl area.
Yeah, and that's I think the surprising thing for most people to see is that the fat around the nasolabial folds and like in like kind of the cheek itself does tend to stay the longest. Like this fat tends not to go away.
Right.
Which is interesting. If you look on the slide, if you're looking, the 5 on the slide on the right, I mean, that's that area just behind the marionettes.
So when she
tends
points
not to go away.
Yeah, so when she points to the 5, she's actually pointing to the area of jowling, and that's a problem because it doesn't go away, and it also descends and creates jowls, which is what liposuction along the border of the jaw. So the fat does stay in that lower face and then descends and gives you that kind of melted Salvador Dali melting clock appearance, and the eyelids become devoid of fat. They lose fat. And then that's even worsened by herniated fat of the lower eyelid. So the fat that's kind of around your eyeball starts pushing out when those ligaments soften. Mm-hmm. And then you lose fat around it. So in this, in this nightmare scenario,
I know, it's sounding really bad.
I know. You get like, loss of volume along your orbital rim, which makes it look harsh and not youthful and soft. And then the fat herniates out from your lower eyelid. That in combination really does create that kind of tired, aged appearance. You see that in the late 30s and mid 30s and really starts to progress in your 40s, which is, Amy is about as good as it gets. But both Amy and I, that if you want to talk about where we age, it's our lower eyelids and, just around our eyes. Your face is doing awesome. Mine's hanging in there. Yeah. But,
and part of that has to do with animation, too, because our eyes are very expressive.
Right. And that's part of the problem. What's the thing we always say? Thin skin.
Thin scar.
Thin scar. So, like, it's the thinnest skin around the eyes. And so just, that's mechanics. We should have a physicist, not a physicist, like an engineer on here. If you move something enough, the actual structure changes. It starts to bend and mold. It starts to adapt really to that movement. And just think about opening and closing your eyes, smiling, all that kind of stuff.
Well, go ahead.
Good. That's why they say to take Botox earlier rather than later, because theoretically you can prophylactically treat those areas and stop some of those changes in skin. I'm not sure.
Potentially.
Yeah. But that seems like something that was
marketing.
Was released by the Allergan marketing team. If you started when you're 25, you will never have any wrinkles on your eyelids.
That's right. And people have said that. And I'm like, well, that's not real. That's not real life, but whatever. There's other issues that go along with the area around the eyes that you were kind of touching on. And one of them is that there's not the sebaceous glands or like the sweat glands around your eye like there are in other places of your skin. So you don't get those lipids brought to the surface to kind of hydrate that area, which is why the under eyes look really dry.
Did you see these Hollywood people not bathing and not washing themselves?
Yeah, but I haven't really looked into it. Is that why?
That's what they're talking about.
To bring the fat to the skin?
Yeah,
you know what happens? It oxidizes and you smell bad.
Well, they're not worried about the smell.
Oh, okay. They want it for the hydration?
Yeah, for the hydration.
Like literally that's why old people smell. Because their bodies can't break down the lipids on the surface and they go rancid. That's why old people have that old person smell. That's a real thing.
So you're telling me that Ashton Kutcher smells like an old person?
Well, he might if he's not taking a bath.
I don't know. That was like
oxidized
I didn't read the article.
The
as usual, I did not read the article.
I haven't read it either.
No, I didn't read the article, but I read the headline. Ashton Kutcher does not bathe. All he does his armpits and his groin.
Oh, well,
And then he washes once a week.
Which is water? I mean, or does he just not use soap or does he not use water?
I'm not really sure what his cleansing method is.
You weren't in the shower with Ashton Kutcher?
With Ashton Kutcher and Mila Kunis.
But that does add to the aged appearance around our eyes is the fact that they're just not as hydrated as the rest of our skin.
Which is why actually some of those products actually do help your eyes. Those hydrating products around your eyes. Yeah. They do make a difference.
They do because they keep it hydrated. They add hydration that isn't there. So like they're thicker, more emollient products around the eyes. That's for a reason. So people who say that eye cream doesn't matter, just use anything around your eyes. Well, that's true and false. It depends on what you're using everywhere else, but you can definitely benefit from added hydration around your eyes. Specifically things that are helping to like give you more lipids around there.
So I can totally tell my wife has listened to you because the other day I was complaining about my eyes. She's like, use some eye cream. And I was like, I don't feel like it. She goes, you need to hydrate your eyes.
Yeah.
The skin's different there. I'm like, oh, Amy.
Well, and the other thing too.
Like, I can just tell you, I was like, oh my God, it's like I'm talking to Amy now.
Right. But when you think about the eye, I mean, it's very much like skin muscle.
Yeah.
Right? Like, so the muscle is working all the time there. So that starts to get kind of worn out quicker too, like you were talking about. So you've got the skin that's not being hydrated naturally because it doesn't have those lipid.
It's also very thin, so it doesn't have a big collagen layer.
Yep.
Yep.
And then these ligaments that are there are so tiny. They don't have a lot of strength to hold everything up. So.
And then next, the fat herniates out from below. Above, your brows droop. You get hanging
that
skin.
fat goes away too.
That fat goes away.
That's why you look all hollow.
Yeah. Hollowed out eyes are really pathognomonic for aging. Some people really want to clean out fat in their eyes, but really super hollowed out eyes don't look youthful.
You look old.
Some people have that genetically and they look fine, but it's not a youthful look.
Right. So now we've talked about all the terrible things about this. Let's talk about enhance versus restoration.
Okay.
So then this is by decade of life. So there are times in life, which is usually your 20s to 30s, when you're doing changes on the face, you're wanting to add volume.
But we do agree that the biggest thing with aging, and you and I agree, is fat.
Yep.
Either fat loss or fat descent.
And that really can tell you how old a person is.
Great. And there's anatomical studies that prove that.
Yes.
Okay. So we've proven your salacious title.
Yeah.
It's not fake news.
It's real.
It's real. Okay.
It's real. So if you're in that enhance range, right, those are people who are wanting to just add some volume to the cheeks, add some volume to the lips. That's great, right? When you reach the point of restoration, which is meaning your 40s and beyond, yes, you can continue to add volume, but what you're really doing then is not enhancing, you're rebuilding. Because you're not adding on top of what's already there.
So enhancing, you're referring to people that are deficient inherently.
Who are just wanting to add to what they have.
That's what I'm saying. They're deficient.
Perhaps.
Maybe not related to aging, younger. Yep. You just want to enhance your lip. You have thinner lips and you want to make it a little bit bigger.
Or you have full lips and you want to make them bigger.
Okay.
Yeah, whatever. Like you're adding to what's really there.
Right.
To what you have. But restoration is that point where you're needing to replace the volume that's lost, which is probably getting into some of these deeper fat areas of the face, in addition to replacing the volume that's been lost in like the areas around the eyes. So let's kind of break that down a little bit deeper. And this is what you were kind of getting at before, which I didn't want you to jump all over because I had such a great slide for it. So
I should probably look at these slides before.
Right? So your decade.
But it would change the dynamic.
It would. It wouldn't be as much fun.
It's a real conversation.
Yes.
Like we are having a conversation.
We are.
And I'm really into it.
Me too.
If I looked at the slides, I wouldn't have known,
Nope.
I would have known.
You'd be waiting for the slide. So let's talk about your decade facial rejuvenation prescription.
All right, hit me at it.
Dr. Martin's board certified plastic surgeon.
Board certified.
They give you a prescription for facial aging. So 20s and 30s.
Okay.
What are the things that we should be doing in our 20s and 30s?
So I'm not looking at the slides. We definitely should be using products. At least a retinol. Retinol, maybe not Retin-A. We should have a whole skin regimen. We should definitely use sunscreen. I'm sure you have SPF on there. Tell me you have SPF on there.
Yes, I do.
Okay, good. And also, even in your late 20s and early 30s, you can do hyaluronic acids. How many did I miss?
There's a couple, but so fillers. So if you're looking to enhance, remember this is the enhancement decades. So you're enhancing the volume you have, and that you do with hyaluronic acid fillers, Juvederm.
Light laser, that's what I missed. Okay, that's fine.
Retinols, that's just keeping your skin healthy. It encourages cellular turnover, helps with acne, helps with kind of preventing fine lines.
So everything we talked about, besides the fillers, is treating the outside.
Yep, this is all skin.
It's all skin related. When you're younger, the skin is really, you treat that, and then that makes a big difference, right? Because that's really usually the issue, because you've had the more of the insults have been on the outside at that point. You haven't gotten to the aging part where your fat starts to go away or descend.
Right. So you're taking care of things. Light peels, light laser, sunscreen. Right. Those are the key things you need just to keep your skin looking good. You don't need to do anything deeper. Everything else looks great. 40s and 50s. We talked about this a lot in your perfect facelift. Now this could run the gamut of people because this is where aging kind of shows itself as not equal.
There's some people come in, they're like my age. I'm like, what is going on?
Good or bad? Do you mean what is going on good or what is going on bad?
Not usually good.
Oh, see, I think sometimes I'm like, wow, like
no, there's some people that come in,
yeah,
but they're usually like not us. They're not like Irish, German descent. They're like South American.
Yeah, or there's just people who look amazing in that age group.
There's some people that do, yeah.
But remember, this is when we're getting into the enhancement phase. So yes, still, if you're wanting to add volume, especially like lips, hyaluronic fillers are going to be great. This is though where we start to get into superficial and or deep fat grafting. Mm-hmm. Minimally invasive skin tightening, like face tight. Maybe you're ready for a face or neck lift. Deeper medium peels, right? Laser maintenance, still retinol, still SPF. So that time in your life where you start needing to do, maybe some of both, right? We're treating the inside and the outside now.
Yeah, so you definitely treat the skin, deeper lasers like ablative lasers, fat grafting, so volume enhancement,
Restoration.
volume restoration.
Restoration.
Volume restoration with fat grafting is really important. We got a new device in our office called Beautyfill. It's an amazing device, and it's really just geared toward fat grafting and really specializes in facial fat grafting. So, fat grafts are, and we talked about fat grafting before, are amazing because it takes your own body volume and transfers it to your face, and it's amazingly, most of it survives, about 60% if you do it correctly, and it's a permanent answer to volume changes and volume loss. When we do body tight or face tight of the neck, face tight also tightens the skin, so you start to develop loose skin along your neck and jawline, and we remove the excess fat that's down there. You don't want to go in and remove fat on your cheeks, right? Because you're losing fat there or it's descending. So we're not doing face tight on your cheeks. There's a lot of reasons we're not doing that, but that's one of the reasons that really wouldn't be helpful. It would work against you from an aging standpoint.
Well, that's why even things like AccuTite need to be very conservative around the eyes. You don't want to be, destroying any little bit of fat that's left, and why fat grafting works really well in conjunction with some of these procedures too.
Right.
So replacing the superficial and deep fat is actually important too, because remember that deeper fat is what's giving support to the muscles in a lot of cases. So that's usually done at like the time of like a facelift or something that's more invasive. You're doing those deeper fat pockets. So 60s and beyond, this could be many things.
It's potpourri, man.
Yes. It's still everything we talked about before.
It's like going to Vegas and going to the buffet. You can have whatever you want.
And this is something we tell our patients who are getting facelifts even in their 60s. Like they're like, will I ever need Botox and filler? And the answer to that is yes and yes, because they do different things than what your facelift is doing. So replacing those deep and superficial fat pads, doing a face and neck lift, deep peels to really help get that dead skin off.
Deep lasers.
Yep, like resurfacing lasers, still using retinol, still using SPF. Those are all things that in combination are going to help you kind of replace what is not only missing now, but also has descended.
So when I think of retinols, I differentiate it from Retin-A, but you're not here, or you are?
I just put retinols because depending on the person, some people may never be able to use or tolerate Retin-A.
Okay.
Or
Retin-A, like Retin-A itself is just kind of like old school. I mean, do people just preferentially just give retinols now?
No, I mean, I think tretinoin and Retin-A are still very much prescribed. I think they're definitely used in somewhat lesser percentages than they used to be.
Because the retinols have been, kind of taking their space a little bit?
Not necessarily, just because I think we've realized that more isn't necessarily better.
Gotcha.
Like having somebody's face just be red and flaking all the time doesn't lead to a better outcome. So having a tretinoin percentage that might be even, it used to be the lowest percentage we'd have would be like a 0.25, and people were using like a 0.5 or a 1%.
No, we had people like that.
Yeah, it's insanity.
Like about 10 years ago.
Yeah, the percentage I use of tretinoin is 0.018 or 0.02. Very small percentage, but I'm able to use it effectively and more often.
I use a retinol, and that's enough for me. I mean, you can feel it on the skin. So
yeah, and if it's working, I mean, that's why when we talked about that in our episode about facial procedures or skin procedures, skin else could really tell me, skincare 101.
Skincare
101.
I got you, Nielsen.
There are literally thousands of skincare lines out there, and a lot of them are going to tell you like whatever formulation or whatever of their retinol or their retinoids is better.
Is that the one where we talked about the strange things people do to their face?
Yes. Mm-hmm.
You have to go listen to that episode.
If you want to hear about sheep placenta and some other interesting facial treatments, that's in that one.
That definitely made both of our top fives.
Yes, but that's finding all of these things that work for you with all of these things: the peels, the laser, the resurfacing, the facelift, the fat transfer. Like finding a place that works for you. Not everybody wants all this fat transfer to look like they're 40 when they're 70. That's not what everybody wants. Some people don't want any fat transfer at all. Like they don't care the fat's descended. Like that's fine.
Some people actually like their face better with it more thinned out.
That's just life.
I mean, you can look at me. I had like a round, cherubic face. I probably look better more thinned out.
You also weighed like 30 pounds more.
Why you got a fat shame?
I'm not. I'm just saying, like, those two are not completely equal. Like, yes, you had a round face and a round tummy. I mean, I notice it when I gain weight, my face looks fuller. Is
Yeah.
that good? Maybe.
Yeah, I mean that's where you get into people's judgment on aesthetics,
Yeah.
and it's all wacky.
Right. And it's
Some
what,
people just want to have this big round face, and it just doesn't look good. But that's my opinion.
yeah,
So,
and that's why there's so many options. Yeah, there's a
Right.
lot of options. So what we have learned today is that your fat can predict your age very predictably, and where your fat is tells you how old you probably are.
we've shown that fat primarily goes away with age. It also descends, and it descends in areas that makes you look older, especially the jowls or along the neckline.
And that your skin is not the biggest problem with aging.
Your skin is not the biggest problem with aging.
You should
It's
definitely
one-
take care of your bones.
Yeah, and then even like with your bones and your bite. Your bite's a big part of aging, and we used to share office space with a cosmetic dentist who's really good, and he and I would talk about this all the time. That the occlusion, the way your teeth fit together, really do manifest itself in your facial aesthetics too.
Well, even how strong your masseter is.
Yeah, your
Like,
masseter muscle.
People who stop or on a liquid diet or stop eating can look really hollowed out because their masseter starts to atrophy.
Yeah,
Makes you look weird.
so interesting.
It really is.
And I do so many face and neck lifts, and so much of my work is lifting the foundation, which is basically those fat pads. So everything we talked about here, I address every week, and that's why we're kind of inclined to actually do not enhancement, restoration. Make sure I get Amy's word correct. Restore at the same time of these face and neck lifts. So if you're in your 40s or 50s and you're struggling, definitely restoration of volume in your face is really important within reason. And
Within
that's,
reason.
Well, that's the caveat, because lately it seems like people just think I'll just keep on injecting. And it is ultimately you go past the point of restoration and you get into some abstract weirdo land.
Right. And that's why, hyaluronic fillers, things like Juvederm and all these other fillers that are on the market, there's probably a time for most people where they might stop doing those in favor of just really getting a more permanent solution of doing some fat transfer. And in some cases, fat is absolutely the better answer because you can't really fill efficiently with filler like you can with your own fat. You just can't. And it doesn't take as much as you might think. Like 1 cc around the eyes,
And we haven't even talked about the stuff that's really controversial right now, like stem cells with fat and everything that goes along with that. We should definitely have an episode like that in the future where we talk about fat and its benefits above and beyond volume enhancement.
Well, and we did that in our episode where we talk about how fascinating fat is. But if you think about it on a very, very basic level as maybe a teaser for a future episode, when you're bringing fat back to an area that's lost it, you're also bringing blood supply back to that area. You're bringing nutrients back to that area. You're bringing stability for the other things.
It's like rebuilding the inner city. You
Yeah.
know, you just like one shop at a time. You're gonna, revitalize, restore.
You restore.
You're not going to enhance. You're going to restore.
You can do both, but
Yeah.
At some point you got to restore.
Yeah.
Oh, Dr. Martin, I really enjoyed this episode, and I hope that everyone listening enjoyed it as well.
I mean, this is definitely where my headspace is right now.
Yeah.
So,
Yep. We really appreciate everybody listening. We would love it if you would leave us a comment, a rating, a review. It really does help us, helps other people find us. There's the number right there, 303-630-9038. If you'd like to leave us a voicemail or a comment or just want to say hi, I do listen to those, and I get
I
texts
feel
there
like I
too.
should squeeze my hands a little shorter to see if Nils can fit it in there.
Shrink it in, right?
It gets so much smaller.
I feel like you should open it up so it comes out from the
Again,
middle.
we've asked Nils, just for everyone watching, to bring the number around my head.
Like a halo.
Yeah, like, some CGI.
Well, what if it's just like one of those location finders where it's just spinning above your head?
I like it. I want some more of that.
I think that'd be good.
Yeah.
Yeah.
It's
Not
on the
on the
budget.
budget. Oh, well, maybe later. All right. Well, we do appreciate everyone for listening, and we'll see you next time.
See you next time.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.